WestBeWell was set up because we knew that there was a huge interest in mental health in our area, coupled with a huge need to know about trustworthy, reliable, safe mental health supports and services. We were also very much aware that during sad and difficult times in our communities, it was very important that we share reliable, safe messages so that people know where to turn to. We want to continue to build a strong and trusted brand through WestBeWell.
At the initial development phase, we consulted with key stakeholders to influence the design of the WestBeWell resource. We talked to young people from the Jigsaw Youth Advisory Panel, from Mindspace Mayo and from Forum Adolescent Support Project in Connemara. Our work has been made possible through funding from the HSE Resource Office for Suicide Prevention, from HSE Community Healthcare West, from Children and Young People Services Committee's funding and from Healthy Ireland funding.
One of the first tasks we did when we set up WestBeWell was to really widely promote mental health supports and services. And we done this by redesigning and updating a wallet-size card called Numbers If You Need Them. This was developed into posters which were displayed in hospital emergency departments, an A5 flyer which was distributed to every home through newspapers, and also a small fridge magnet distributed through communities as well for older people.
On this website we have 4 key features. The first feature is a directory of mental health support services. We also have services that are 24 hours a day, 7 days a week. We also have a resources section with useful reading materials. The third feature is information on training and different opportunities in terms of suicide prevention training that is available throughout the 3 counties and throughout Ireland, supported by the HSE. And the final feature is a news and events section, which sets out different activities, programmes, new developments that are happening around the 3 counties. As well as our website, we communicate through traditional media like newspapers, radio stations, and in communities through businesses and community groups. And we also have a strong social media presence through Facebook, Instagram and Twitter. It's very important that any information that we have on the website is accurate and up to date, as it can take a lot of courage for people to reach out for support. We also want to share the learning with other communities and other groups who could benefit from this.
The information we provide on WestBeWell is available to individuals, families, communities, young people and service providers across the region.
We have teamed up with other groups also to promote WestBeWell. Last year we teamed up with the GAA County Boards for Galway, Mayo and Roscommon to really promote WestBeWell at championship games. And more recently with Sea Change, the national programme dedicated to ending the stigma and discrimination surrounding mental health. And this was to host an event in June called Let's Talk Mental Health Judgment. We also promote specific information based on an identified need within our community. One example of this was information for coping during exam times for parents, carers and students, which we delivered last year. During a time of distress following a loss, we also can use social media effectively to share specific messages for our communities.
Ultimately, our goal is to make it easier for people to reach out for support and talk about things that may be difficult or weren't talked about in the past.